Okay, guys. Ruth introduced me at first, but my name's Rick Landis. I'm a certified paramedic in Florida and Indiana. EMS division chief, retired about 7 years ago, was an instructor up there, moved down here. We started this out the back of our house. So my portion of this teaching today is the AED, or the automated external defibrillator, if you want to call it that way, or a defibrillator. Most people know it by a defibrillator. So tell me a little bit what you do.
I'm an LPN.
LPN?
Behavioral Center.
Okay. And
Home health aid.
home health aid and EMT, right? Okay, so I know that you guys watched the video, but we're gonna kind of go over the different uses and why we're using it. I know the video kind of told you some of that stuff, but let me bring it back a couple notches on why we're using it. Do you guys remember what they said? Why are we using an AED? What's the importance of that?
To help correct the cardiac arrest.
Yeah, so help correct an abnormal heart rhythm.
Yeah.
Correct. So, do you remember what they said? What rhythm did they say in there? Do you remember they said in the video?
VFib.
VFib. So VFib always needs a defib, right? So that's the easiest way to remember that. So one of the things that people don't understand is how important the AED is. And I don't know if Ruth talked about this during her portion, but CPR alone only increases the chance of survival by only 10% in a witness cardiac arrest. So it's like, man, I worked that hard for nothing. Mm-hmm. But when we add an AED, we increase the chance of survival by another 50%. That's a lot. So we're upwards of 60% just in the use of that AED and CPR combined. And then we get EMS with IVs and medications and post-cardiac arrest care and so on and so forth. So understanding how this works is kind of important. But one of the other things that we got to worry about is there are all kinds of different shapes and sizes of these AEDs. So what do we do? You know, we have two right here that are completely different. Is there anything that we do different with each one of these? What's the first thing we do when we get an AED? Open it up, then power it on, right? Turn it on. Why is that so important?
Make sure that it's even working.
Yeah, so it's going to come on, but what's the next step after that? And I'm telling you this because there are some test questions on there that goes over this. After we turn on the AED, what's the next step?
Apply the patches.
Listen to what it tells you to do. So the reason I show you the multiple different AEDs, they all do exactly the same thing. They correct an abnormal heart rhythm, but they're going to tell you what steps go into what place. They may tell you different things. Like this AED itself tells you, it just counts down, gives you a metronome, so on. This one will actually say, good job, push harder, push faster, slow down. It's a coach. It's a coach in a box. Our trainer, on the other hand, first thing we do is turn it on, right? What's the next thing? Listen to what it tells you to do.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
The AED said apply pads to the patient's bare chest and then plug in the pads connector. But if I plug in the connector, if I can get these pads open, I'm sorry guys. If I plug in the connector before I apply the pads.
Apply pads, plug in connector.
If I plug in the pads connector before I apply them, right?
Insert connector firmly.
What can go wrong? What do you think? Yeah, so here, I'm gonna plug them in just so you see.
Analyzing heart rhythm.
I don't even have these pads hooked up.
Do not touch
Some of them may say
plug in
connector and then apply pads. But on this particular one, if I plug in the connector, it's already analyzing the heart rhythm before. Some of them come pre-connected, some of them come open with just a
plug-in connector.
Shut that off for just a second. Some of them come open with just open the button. If I open that up, it tells me everything to do at that point.
Begin by removing all clothing from the patient's
See how
chest.
they're different?
Cut clothing if needed.
So it's telling you different things as we do it. These are probably the most popular that you see out and about. Publix, Detweilers, they all have these Phillips AEDs.
When patient's chest is
Some
bare,
are changing.
remove protective cover and take out
Turn this on
white.
because this is a live AED. It's not a trainer. But there's so many different on the market. There's 25 different brands or kinds out there. They all do exactly the same thing. They correct an abnormal heart rhythm, which is VFib, unfortunately. Can we use these on anybody? Can I put that on me right now? I can.
Yeah, why
It's not going to shock me. It only shocks that abnormal heart rhythm, that ventricular fibrillation. So I could walk around all day long with that attached to me. It's just going to annoy me. That's all it's going to do. It's not going to do anything else. But the type of person that we would put this on would be what? Unresponsive. That's the key. Unresponsive. They don't even have to be not breathing and no pulse. If they're unresponsive, we're going to put that AED on them. Sometimes this defibrillator will actually shock a ventricular tachycardic rhythm. The problem with that is it only shocks one ventricular tachycardic rhythm. That is torsades, which you guys don't even know what those are, or you may not. But that person can have a pulse or not have a pulse, whereas ventricular tachycardia can have a pulse. So we don't want to shock somebody with a pulse because we're defibrillating. So we put it on that person and then it will tell whether they need it or not. So let's just go through the motions here. Turn it on. What's the first thing we do?
Apply pads to patient's bare chest.
Cut the clothes.
Plug in pads connector
Apply
next
the
to
pads.
flashing light.
Pads go in upper left-hand shoulder, or in the upper right-hand shoulder,
Apply
and then
pads.
in the
Plug
lower
in
left-hand
connector.
chest, and then plug in the connector.
Analyzing heart rhythm.
We're still doing CPR while we're listening to
Do
this
not touch the patient.
until it says don't touch the patient. The time on the chest is most important, okay? Once it says don't touch, it's going to tell you shock advised or no shock
Charging.
advised. If they're shock advised,
Stay clear of patient.
it tells you to stay clear, but as the operator of
Deliver
this,
shock now.
we need to
Press
make
the
sure
orange
everybody's
button
clear
now.
and then push the button. What do we do
Shock
next?
delivered.
Immediately resume.
Right back into chest
Begin
compression.
CPR.
Now, the reason that we use the defibrillator to correct that abnormal heart rhythm is, who thinks that we jumpstart the heart? No, we don't. We're actually stopping the heart. It's a reset button. It's kind of like the reset button that you get in your GFI outlets. If we get water in them, they trip, we have to push the button and it restarts it. This kind of does exactly the same thing. So, this beeping, what do you think that is?
Is that
It is the rate that we're doing CPR in. Almost every AED has that metronome in it. So I know they talked about it in the video about a metronome, and if you don't have one, download one. You're not going to have time to push a metronome. And if you have an AED, almost every one of them have that metronome in it. So it just kind of helps you stay in rhythm on how fast you can push on that chest. So what if this AED said no shock advised?
just keep doing compressions?
If there's no signs of life, we go right back into compressions. What's signs of life? What does that mean?
Pulse, breathing, responsible.
Pulse, breathing, moving, blinking their eyes,
Mhm.
trying to grab your hands and stop you, right? Yeah, we don't want to do that. After you clean your pants out, you want to make sure that you got that right. So, how about, can I put those pads anywhere other than what's on those pictures?
I think so.
You actually can.
Pediatrics.
Yeah, so pediatric pads are preferred for pediatric, which is what I've got on here. But if we have adult pads, we can use adult pads on a pediatric patient. In all reality, the pediatric pads, the patient has to be actually under 55 pounds. So unless you're a good carny and you can guess what their weight is,
Yeah.
if you got a kid this big, I'm putting the adult pads on them, because what happens is pediatric pads have a reducer in them, right? pediatric dose attenuator is the technical term of it. It's just a reducer of that energy. It doesn't allow the energy to go over 100 joules, which I know that doesn't make a lot of sense to you, but the way defibrillators are made nowadays, they're biphasic. So it reads the resistance between the two pads, and then when we deliver the energy, it delivers only the energy that's needed to correct that abnormal heart rhythm, right? So, but go back to the thing with the pad placement. As long as those pads cross the heart, it doesn't matter where we put them. So I can put them here and here. I can put them here and here. I can put them here and here. I can put them frontwards and backwards on the back side of the patient. It doesn't matter. Now, as a bystander, every AED has a picture on the pads that shows here and here. That's so anybody that doesn't know how to use it can use it. My 7-year-old grandson can effectively use this trainer without any problems. He turns it on, listens to what the directions are, puts the pads on based on the pictures and follows what the prompts say. Pretty simple use. No question on it. I don't want you to fail because my grandson did it, right? But you guys can do this. This is pretty simple. What if that patient has a hairy chest? What do we need to do? Shave it. What if I don't have a razor?
Place one of the pads on it.
What if I don't have any extra pads?
You push it down.
Push it down. See if we can get it to stick. So somebody that has this much hair on their chest, pads probably are not going to stick. But somebody that has this much hair on their chest, pads will stick on that and you'll do just fine. The only thing you're going to do is you're going to smell some burning hair. If you got a lot of hair, all public access defibrillators have razors with them. So in a public access defibrillator, you're going to have some type of kit. At least here in Florida, you're going to have a kit that's with those. On an ambulance, you'll have that kit with you. In the hospital, on your code cart, you're going to have a razor in that kit and a bag valve mask or a pocket mask with that. This kit has in it a pocket mask, so we can give rescue breaths. It has the old 2-cent razor. It's usually a double-sided razor that has safety guards on it, so it won't cut myself and it won't cut the patient. We're not trying to make it really smooth. We're just trying to get that majority of that hair off so we can slow those pads on. Now, it also has a pair of scissors in it. This one does not, but this one does. Has a pair of scissors in it. Why do we need scissors?
Cut shirts.
Cut shirts. How about bras? Do we need to remove a bra? If we can't work around the bra, then yes, we do need to cut the bra. Got to remember that there is underwire on some bras, and we don't want that energy going through that metal and causing any burn to their chest or whatsoever. So we got to make sure we remove that bra. Now, some people are hesitant about that, but just remember, like she said in the previous, is, you know, somebody's going to say, go get the AED and call 911. You, come over here and help me. You, get everybody else back. Why do we want to get everybody else back? To protect the modesty of our patient. Now, in-house or in a hospital setting or a nursing home setting, it's all workers that are going to be there. It's not that big of a deal. But in public or in EMS, we got to make sure that we got people back. So that's what our firemen are good for, right?
Yeah.
Hey, get everybody back, okay, so we can do our job. It's kind of important. But all those things come in there. How about gloves? Do we need to have gloves on when we're doing CPR?
If you have them.
If you have them, yeah, but if there's no body fluid or anything, it's okay. Just wash your hands afterwards. You're going to be okay with that. How about pacemakers or defibrillators? Can I put a pad over the top of a pacemaker or defibrillator? No. So what do? You know, those pads, they say go here and here, and the pacemaker's right here. What am I going to do?
Put it below it.
I can move it just below it as long as it still crosses the heart. But what else can we do? We just talked about it. Move those pads to the other side, right? In most cases, the defibrillator pacemaker is not in the right-hand corner. Most of the time, it's on the left-hand corner. The only reason we can't put a pad over it, it's not going to hurt that pacemaker defibrillator, because if they're in cardiac arrest, that pacemaker defibrillator isn't working. So the reason is it's a resistor. So that energy, remember I said it measures the resistance, then it delivers the energy that goes back across the chest. If I have something over the top of something, it's gonna be a resistor that it's reading and maybe not deliver the right amount of energy. So we can just flip flop them. How about piercings? They didn't talk about that in the video. People have these dermal piercings all the time. They have nipple piercings. Do we remove those or what do we do? It's a good question, right?
I would
Yeah.
think just leave them, but
Yeah, so you can't take out a piercing. It's gonna put you in a whole heap of problems, legally, if we get these people back. So, and if they're dermals, they actually have to be surgically removed. You can't just pull them out. So just put that pad over it if you can avoid it, okay? Nipple piercings, the pads don't go over the nipples, so there's no need to even come close to that. They go in the upper left or the upper right. How about medicine patches? Remove them with, we have to have our gloved hand. Okay, so now let's say it's a Duragesic patch, a fentanyl patch. What are we gonna do with that? Just slap it on our arm and keep going? What are we gonna do with that? Yeah, right? So, yeah, put it on there. We aren't gonna be in pain, and this hurts, so we'll be okay. No, do not do that. That needs to just go in the inside of your glove. But what do we do with that patch after we get it off?
bring it to the hospital.
Bring it to the hospital if you're in the back of an ambulance. Or if you're a nurse, you know that those Duragesic patches are a controlled substance and you have to account for those. So very important, and it's a very big deal on the back of an ambulance if you're out in public that you don't leave those laying around. Why is that? Why do we not want to leave?
Pick it up and touch it.
That's right. So anybody can pick, ooh, look at that sticker, mommy. And they pick up that medicine patch and put it on. And then we also have in EMS, we have to be concerned with substance abuse people on the streets that they chase ambulances. People are like, what do you mean they chase ambulance? They'll go to an ambulance scene, and as soon as you leave, they're scouring an area to find if they can find anything that can help them, either a needle or a Duragesic patch that we took off. And now we have a opiate overdose because they cut that Duragesic patch and put them under their tongue. So kind of important thing that we make sure. If you're a tech and you're in a nursing home or whatever, make sure you give it to the nurse so she can account for it. What if the family member says, hey, I just put that patch on him today. Don't take that off. What are we gonna do?
Tell them why we need to take it off.
Yeah, so what's important about that whole thing that they just said? We just put that patch on him today. We gotta be concerned that that patch is what caused them to go into cardiac arrest, right? So these are things that you might run into as a home health aide, is your patient has a brand new Duragesic patch that they were put on, and you walk in to take care of them and they're in cardiac arrest, or they're not breathing because they had an overdose of that patch, right? Or any patch, we can have, blood pressure medicine, pain medicine, nitroglycerin. What if I put a pad over the top of a nitroglycerin patch? It could blow up.
Really?
Nitroglycerin is an explosive. It's in a minute form, and it's not gonna put a big hole in their chest, but it is gonna put a pretty good mark on them and burn them pretty bad. So gotta move those. How about if this person was drowning? They drowned. They were in the Gulf of Mexico. What do we do for that?
Pull them out.
Pull them out.
Dry them off.
Dry them off. Do we have to get them completely dry? No, just enough to where the patches will stick. Back in the day, these AEDs, they electrified the whole body. Now they don't. They only shock between the pads. So back in the day, when we pulled somebody out of water, we had to make sure that we weren't kneeling in that water or we got shocked. So now you don't have to worry about that so much, unless that water's coming up over the top of the patient or it's a heavy downpour. We can actually use it, dry them off, put the pads on. We can use it in the rain, but just remember water conducts electricity. So it's gonna reduce some of that energy level that comes out. Okay, so we talked about pediatric pads and adult pads. Adult pads can be used on adult patients, children, and infants. We just changed the location of it. Pediatric pads can be used only on 55 pounds or less. So most AEDs nowadays do not have adult pads, infant pads or pediatric pads even with them, because in all reality, they were kind of a selling gimmick for people, because most kids don't go into cardiac arrest, and if they do, it's a respiratory problem, usually not a cardiac problem. We still put the AED on those patients, but we don't want to withhold that CPR in the breast, because that's the most important for them. Any questions or anything about the AED?
I actually do have a question.
Yeah.
With the whole shaving the chest, could you just move the pads to the side?
You can.
But is it like considered more effective to shave and place in, this kind of placement?
So time is of the essence in everything that we do. So the quicker that we can get this on and quicker we can get that analyzing is the best thing.
Mm-hmm.
So if you got somebody that's got a whole bunch of chest hair right here, matter of fact, in the cath labs, when we take somebody to the cath lab, I worked in the cath lab for a little while. When we take somebody to the cath lab, we don't put the pads here and here.
Mm-hmm.
We put them here and here. And the reason is if something happens emergent and we have to open that person's chest up, we have access to it. So that just kind of justifies why it's okay to put them here and here, here and here, here and here, frontwards and backwards. But yes, you're right. If you did have a whole chest of hair and you didn't want to take that time shaving it real quick,
Right.
throw them on the sides, it's going to work. But we don't want to stop CPR while we're doing it. So if we have 2 or 3 people there, somebody's still doing chest compressions and the person's putting the AED on, works around that person. Because eliminate those interruptions is the most important.
Nice.
Any other questions? No? Okay, well, Ruth's gonna get you with the rest of it and go and do your skills out there. If you don't have any other questions with that, I think it went over everything here. Okay, thanks
Thanks.
guys, appreciate it.